Hello, Dr. Sandeep. My relative has breast cancer. Can you explain how often she has to visit the doctor after her breast cancer treatment and why?
Now that all the treatment of breast cancer is over, you are quite eager to complete and come out of everything and be a survivor or a winner. The key thing in any cancer is that we declare a patient a cured one only after 5 years. The reason for it is because of the risk of recurrence which is there in all the cancers. Now, that doesn't mean that all the patients will recur or it is quite bad or anything like that. In fact, the fact is, as of today, the worldwide data says about 90% of the patients are cured from cancer if they come in early enough. So, what do we do? Generally, there is a pattern which is followed. So, you will have to visit your doctor every 3 to 4 months, during which the doctor will examine the breast, look for any signs of any changes. So that is one. So if there are any changes, the doctor will ask for some tests. Otherwise, every visit there won't be much tests except if at all there are some blood tests. In addition to this, you yourself should examine and familiarize yourself with the breast and the consistency and feel for any tumors. You can see our breast self-examination guidelines. It has all the details. So when you examine, if you find something abnormal, you need to come to the doctor. There's no doubts about that. Next thing is a mammography test. A mammography or a sonomammography and sometimes an MRI of the breast is advised on a yearly basis or sometimes 6 monthly basis based on the case. That I won't be able to tell you in detail, it varies from person to person, but these tests are advised in order to pick up any small signs that there may be a recurrence. Apart from this, your doctor may also ask for a pelvic examination in the form of an ultrasound or a physical pelvic examination to check whether there is any problem with the uterus or the ovary. Now, uterus is very important because in a young patient in whom we put an hormone therapy which is tamoxifen, it has an increased risk of uterine cancer. Now this drug can cause, it's a very minimal risk. It is not so alarming. The benefit of taking it is much higher than the risk of uterine cancer, and even when the uterine cancer occurs, the outcomes of uterine cancer is very good. So it is safe to take the drug, but we keep the patient on a follow-up and the patient will be examined every once in a year for presence of any endometrial thickening. That means something to do with the uterus. So it is quite safe to take tamoxifen. Apart from this, one more test which is very important for an elderly age group where we start the drugs like letrozole or anastrozole is the bone density test, because these drugs again have a risk of weakening the bone. These tests again, the bone density tests are performed once in a year, and if there is a reason to give some medication, bone strengthening medications will be given. So again the same reason applies here. The risk of bone weakening or the side effect of this particular drug is much lower than the benefit that it gives by preventing recurrence of cancer. So it is considered one of the safest drugs. So only thing you have to be cautious about is performing bone density scan every year, which will give us an idea at what is happening in your bones. Other than this, there may be times when your doctor will advise you some additional tests like PET-CT, chest X-ray or some other tests which may be relevant from time to time in order to get some information, additional information from your body. After all this, once you have been followed for first 2 years, you will be changed over to a 6 monthly follow-up, and after the year 5, you will be declared cured and your follow-up will be changed to an yearly follow-up. So this is how the pattern of follow-up is. Of course, the hormonal tablets which have been started will continue for at least 5 to 10 years. In fact, there have been studies which have shown that continuing these medications for 10 years is advantageous. So your doctor will guide you as to how to take these and how long to continue with these follow-ups. Thank you.